Hello, my name is Kathryn Morgan and I'm a registered nurse. I currently work on a cardiac intermediate care unit. I've recently taken part in a collegiate debate regarding North Carolina House Bill 879, the End of Life Option Act. This bill would allow for patients who are terminally ill to choose to self-administer a life-ending drug. I believe that the best argument in support of this bill is autonomy. Research has shown that many people that express the wish to utilize a life-ending drug do so because they are striving to maintain a sense of self-control. These people are attempting to hold on to a bit of authority over their disease process. As with any debate, there is an opposition. One of the strongest opposing points is in regards to psychiatric illness. Psychiatric illness, such as depression, could be considered incurable. Using this reasoning, many more people become potential candidates for terminal medication. There is belief that if mental illness is considered grounds for medical termination of life, that movements such as the End of Life Option Act may be abused. As far as where this bill currently stands, the End of Life Option Act has been filed, read, and passed the first reading, and has been referred to the Committee on Rules, Calendar, and Operations of the House. Next, I will discuss reasons for supporting the End of Life Option Act. The first example of support is the comparison between the use of treatment options that are in clinical trial stages versus the right to die movement. Drugs that are in their clinical trial stage are drugs whose safety and effectiveness have not yet been proven. Use of treatment options whose safety and efficacy haven't been proven run the risk of causing lethal harm to those that use them. However, they are still an option for patients. Why is it that patients have the ability to use treatments that could potentially cause their death, yet so few states allow for patients to make the conscious decision to discontinue all treatment and purposefully medically end their life? The second supportive reason is autonomy. Autonomy should be grounds for supporting the right to die movement. Terminally ill patients often lean toward end-of-life options because they have a willingness to maintain self-control. Many terminally ill patients that are able to obtain medication to end their life through right to die laws don't actually use the life-ending drug. This points toward a desire for control over the remaining course of one's life. The third supportive reason concerns the nurse's role in advocating for their patients. End-of-life medications can simply be an escape from the physical bearings of terminal disease processes. Many terminal illnesses are accompanied by extreme fatigue and pain. With the knowledge that death is imminent, patients may choose to end their life medically when they feel that they can no longer endure the symptoms associated with their disease. Death is innately connected with life, and nurses are tasked with the role of treating patients holistically throughout their lifespan. Nurses can't actively participate in the hastening of death as it violates the American Nurses Association position statement. However, nurses are encouraged to remain non-judgmental, and in states where right to die laws are in place, it becomes a nurse's responsibility to provide objective information that supplies respect to a patient's wishes. I believe that this bill should move forward so that it becomes legal in North Carolina. Further, I think that the End of Life Option Act should be legalized as soon as possible. Although I don't think that this bill could be amended to include a nurse's role in assisting the medical hastening of death in terminally ill patients, I certainly think that this legislation could open the doors to incorporating nurses into this role. Thank you.